Hi.
Hello Hi9 viewers, I am Dr. Ajay Thakur, consultant orthopedic surgeon and a specialist in sports. In continuation with our science of cricket injuries, today I will talk about the leg and injuries to the ankle, foot, knee and the thigh. Now you all know that this human body is actually a biomechanical miracle. Why do I say that? Now imagine we have springs in our body, we have cushions in our body which protect us, which gives us the power to do lot of activities, jump, run. So let us see, there are three types of springs in our body. The first spring is the power generator spring. Now what are these? These are nothing but your muscles and tendon units. The muscle and the tendon, they work together to generate that explosive power for you to jump, for you to throw, for you to run and for you to lift weights. Now what happens is when you're lifting these weights, if the biomechanically there are some faults or the technique is wrong or you're not able to there are mechanical malalignments in the body, these muscles they tend to over exert or tend to imbalance and then cause injuries in the tendons. For example, you have injuries in the tendon like hamstring injuries. Very common in cricketers who run, fielders and then batsmen, when they try to make a sudden run, they tend to injure these because the body is not prepared. So this muscle tendon can cause problems. The second type of spring, what I call the stabilizer spring. What are stabilizer spring? These are nothing but ligaments. Now imagine you have the knee. In the knee you have cruciate ligaments. These are commonly called ACL, PCL. What they do, when the knee twists, they tend to shorten like a spring. When you tighten a spring, it shortens and that packs the joint in a very stable position or locks the joint. Now in our leg there are so many ligaments. When we talk about ligament which is a spring, there is a ligament called as a spring ligament in the foot. It maintains the arch of the foot. When this ligament is not working properly, so this spring is not working properly, the arch of the foot tends to be flat, or we call the sports person to be having a flat foot. Sometimes it can be, the arch can be more or the spring ligament can be acting more than the normal or maybe tight. Those people will have a high arch foot. What problems can they have? Now they can have problems in the pain in the foot and the ankle, heel pain, plantar fasciitis, Achilles tendinitis. Then they have knee pain, what we call as jumper's knee or runner's knee, patellar tendinitis, chondromalacia patellae. In the hip also they can have problems like chondromalacia of the hip or impingement of the hip. All these problems can happen especially in fast bowlers or who are involved in running a lot. Now the third type of spring, what I want to say, is a shock absorber spring. Now shock absorber spring, what do? They absorb the shock and the impact when you jump or when you run or when you try to hit something, lift something. Examples are cartilages around the joints and then meniscus and the labrum around the joint. What do? They act like a small sponges which takes away the shock and protects the joint. Now people who have, or the sports persons who sustain injuries to these structures, cartilage or meniscus, we tend to have a lot of pain and they most of the time they are out of the field, or sometimes if the injury is severe, it can be a career ending injury. So these three types of spring we need to take care or we need to manage when we see sports person with, especially in cricket, fast bowlers, batsmen and fielders, they are prone for injuring one of these springs. Thank you.